So we finished with the blood flow through the chambers of the heart. Remember, 1, 2, 3, 4. And that's basically it. And here in the book, they're showing you way too many lines, but I think still okay. So then we have the coronary circulation. The coronary circulation is the circulation that is going to provide blood to your heart. We already talked about it a little bit. So it's very important because at the moment that the heart does not have oxygen, the heart is going to suffer and it's going to die almost immediately. So it's very important to know how the heart gets the blood for nutritional purposes. Arterial supply, meaning all the arteries that you're going to have in your heart. There are two main arteries. As you can see, here is the right coronary artery that comes out of the aorta right here, as well as the left coronary artery. The left coronary artery, you can see here, is going to give you the circumflex, and it's going to go here, and then you're going to have the anterior interventricular branch. The right coronary artery will go to the back. That's what you see. This is a posterior view. You can see here the right coronary artery again. Okay, it's going to give you the posterior interventricular branch right here. The veins, there's three main important veins, but I want you to pay attention to this part. You see, it's kind of like a small sac right here. It's called the coronary sinus. You're going to see why I'm showing you this. So let's take a look with a little bit more detail. Oh, before I continue, let's take a look how the blood supply of the heart is. So earlier, when we were talking about the hemostasis, we're saying that sometimes the blood coagulates and forms, embolus, right? And these embolus are going to travel usually from the legs, and they may get stuck right here in these blood vessels. And again, if there's not enough branches for these blood vessels, so there's going to be some areas right here in the heart that are going to lack oxygen, and that's going to cause, best case scenario, angina, worst case scenario, a heart attack, right? It's going to be an infarct. So let's keep going down and let's see the branches. So right here you have the left coronary artery, and there are two main branches, the anterior interventricular branch as well as the circumflex branch. So you don't need to know the details as to where do they go and how do they actually travel through the heart, but you have to know the branches because, again, these are definitely questions that you may have or you may need to know later on in your education. So left coronary artery gives you the anterior interventricular branch as well as the circumflex branch. So let's take a look at the right coronary artery. Right here you have right coronary artery is going to give you the right marginal branch. Okay, and then the right marginal branch eventually is going to give you the posterior interventricular branch. So you can say that these are the two branches of the right coronary artery. So let's keep going down, and we can see, as we were saying, myocardial infarction. I already mentioned that due to the fact that we may have a blood clot. And right here you have angina, heart attack. As I said, angina is just pain that you get in your heart or around your heart, and heart attack obviously is the death of your walls in your heart. So veins, venous drainage, right? As I said, there are three main veins: great cardiac vein, posterior interventricular vein, and left marginal vein, as well as the coronary sinus. These three veins that you have in here, they're going to collect the blood from your heart, and eventually all three are going to dump the blood into the coronary sinus. The coronary sinus basically collects the blood from all these veins, and then the coronary sinus is going to dump all the blood from the heart into your right atrium.